This is a public service announcement for Chikungunya virus in Tanzania. The chikungunya virus is caused by the chick virus. It was first discovered in Tanzania during the 1950s and is transmitted by mosquitoes native to Tanzania, other parts of Africa, Asia, South America, and the Pacific Islands. These mosquitoes are also known to spread dengue and Zika viruses. While the mosquito that spreads chikungunya most often bites during the day, it is best to take precautions at night as well. If exposed to the virus, symptoms typically begin between 3 to 7 days, but can have residual effects for months. The most common symptoms are joint swelling, fever, headache, muscle and joint pain, and rash. Joint pain may last for months after becoming ill from the virus. Death from the virus is rare. However, infants, adults over the age of 65, and anyone with chronic health issues or a weak immune system are at risk for developing serious complications. Symptoms of chikungunya are similar to dengue, and if you've been bitten by a mosquito and develop any of these symptoms listed, please seek medical care. A blood test is used to diagnose chikungunya. There is no treatment or vaccine available for the virus. Therefore, it is important to get plenty of rest, drink plenty of fluids, and take acetaminophen for symptoms. It is important that you do not take non-steroidal anti-inflammatory drugs, such as ibuprofen or aspirin, until you have been seen by a medical doctor to rule out dengue, as these drugs may cause serious bleeding. There is no vaccine for prevention of chikungunya, so it is important to take measures to prevent mosquito bites. Use sprays that contain 20% DEET or picaridin when possible. It is also important to wear long sleeves and long pants to protect your skin from mosquito bites. Make sure to empty any water storage containers near your home on a regular basis, as this prevents mosquitoes from laying eggs in the water. Even though chikungunya primarily occurs from mosquitoes that bite during the daytime, it is important to sleep under an insecticide-treated net to prevent bites while you are sleeping. You can also use a mosquito net to cover your window to aid in keeping mosquitoes out of your home. Your local health department will be handing out insecticide-treated mosquito nets for each home, as well as mosquito larvae control. Please contact them if you have any further questions. Thank you.